Hi, my name is Kelly Ingram, and in 2 short weeks I will be graduating from the University of San Francisco with my Master's of Science in Nursing degree. Over the last 2 years, I've been given the education needed to become a registered nurse. In addition, I've been given the education needed to become a clinical nurse leader. You may be wondering exactly what a clinical nurse leader is, so over the next few minutes I'll try my best to kind of summarize what exactly the role embodies. So essentially, the clinical nurse leader is the first new nursing role in over 35 years. It was created in 2003 by the American Association of Colleges of Nursing. This role was developed in response to the highly fragmented, costly, complex, and technical care that is being provided in the United States. As I'm sure many of you know, the healthcare system is constantly adapting and changing. Due to economic uncertainty, increasing costs, growth in biomedical services and technological advancements, nursing shortages, and changing patient populations, the American Associations of Colleges of Nursing recognized that a new role was crucial in filling some of the gaps that are prevalent in the healthcare system. So, the clinical nurse leader is a master's prepared registered nurse who focuses on quality improvement, interprofessional communication, evidence-based practice, and care coordination. The clinical nurse leader designs, implements, and evaluates patient care by coordinating, delegating, and supervising the care provided by the healthcare team. I want to make an important note that the clinical nurse leader does not replace other roles, such as the nurse manager, clinical nurse specialist, nurse practitioner, or staff nurse. Instead, they're used as a complementary role to bring all of these individuals together cohesively. I want to give you an example about a clinical nurse leader. If a clinical nurse leader was placed on a medical surgical unit, they would spend their time assessing the microsystem to identify any issues that are occurring on the unit. Communication, patient safety, or practice improvement are some of the areas that they can affect change. To give you a patient safety example, let's say that the clinical nurse leader noticed that a particular unit was experiencing an increase in patient falls. The clinical nurse leader would utilize their education to perform a comprehensive literature review on the subject of falls or falls prevention. Through this literature review, they would identify evidence-based practices that would be utilized on the unit to address the problem of increased falls. Next, they would begin implementing the change by educating the staff about the importance of the change while educating them about what exactly the change is. Lastly, the nurse would implement the project and evaluate the effectiveness of the project. If successful, the clinical nurse leader may take their results and implement them throughout the hospital to improve outcomes across the macro system. I hope I've given you some insight about the importance of the clinical nurse leader role and the impact they make if implemented in the healthcare setting.